Organ donation is the giving of an organ or tissue to help someone who needs a transplant. Transplants save or greatly enhance the lives of others. Donation can involve giving several organs after death. This is deceased donation. Or it can involve giving a kidney or part of your liver during life. This is living donation. Donation, living or deceased, is an altruistic act. Around 21 million people in the UK have registered a wish to be a donor after their death. Their wishes are recorded on the Organ Donor Register. Despite all these potential donors, there are still nearly 10,000 people in the UK waiting for a transplant. 1,000 of these people die every year due to the lack of a suitable organ. That's almost 3 people every day. So why, with so many people on the Organ Donor Register, is there such a shortage of organs? Although around 90% of the public support donation, and many have recorded a wish to be a donor, very few of us will die in circumstances compatible with donation. Only patients who suffer a brainstem death, or those whose circulatory death can be anticipated by several hours, can donate. This means that most donors are patients receiving invasive organ support in critical care or the emergency department. Only a few thousand people across the whole country die each year in circumstances where they could donate organs, less than 1% of all deaths. But importantly, nearly all of those few who can donate die under the care of critical care professionals like yourself. So you have a crucial role in fulfilling the wishes of those who wish to donate. Donation can't happen without you. When the time comes, we all want our end-of-life wishes to be honoured by those caring for us. For 1 in 3 people in the UK, this includes wanting to be an organ donor. However, people on the Organ Donor Register don't tend to have donate stamped on their forehead. So unless we check the register every time and explore every patient's end-of-life wishes, we will miss some of those who want to be donors. The easiest way to do this is to refer your patient to the specialist nurse for organ donation. They can check if your patient's wishes are recorded on the register and can work with you in exploring those wishes with the patient's family and friends. Can anyone donate? There are very few absolute contraindications to donation. Some cancers and infections may be a problem. A specialist nurse in organ donation can confirm whether your patient has the option of donation. So who should you refer to a specialist nurse? Please refer any patient who is likely to become brainstem dead or in whom brainstem tests are to be conducted, and patients in whom a decision to withdraw life-sustaining therapy has been made. Why refer these patients? These situations reflect the 2 types of deceased organ donation. These are donation after brainstem death, also known as DBD, historically the majority of donors in the UK, and donation after circulatory death, also known as DCD. There have been increasing numbers of DCD donors over the last decade. One of the main practical differences between the 2 types of donation relates to the timing of organ retrieval. In DBD, because organs are maintained by an intact circulation, donation can be planned for a time convenient to the family, ICU, and theatre teams. In contrast, the lack of a circulation in donation after circulatory death means organ retrieval must commence within a few minutes of death, otherwise the organs rapidly deteriorate due to warm ischemia and quickly become unsuitable for donation. For this reason, a retrieval team needs to be in place before a patient's planned withdrawal of invasive support occurs. Referring your patient to a specialist nurse for organ donation is very straightforward. Most units have their own embedded SNOD, who is your first port of call during working hours. Out of hours, the specialist nurse on call for your region can be contacted through your hospital switchboard. So how can you, as a member of the critical care team, help to ensure that patients who wish to donate get that chance? There are two areas you can help with. Make a timely referral to the specialist nurse for organ donation, and secondly, support a collaborative family approach. Timely referral of all patients undergoing brainstem tests or having treatment withdrawn will help ensure there is plenty of time for the patient's end-of-life wishes to be explored. Timely referral is highlighted as best practice by NICE in their clinical guideline 135 on organ donation, and by the General Medical Council in their guidance, Treatment and Care Towards the End of Life, Good Practice in Decision Making. A collaborative family approach involves the bedside nurse, ICU doctor, and specialist nurse planning together the best approach for a family. Breaking bad news and exploring donation wishes are two important aspects of the end-of-life discussions we have with families. Usually an ICU doctor will lead on breaking bad news before a specialist nurse goes on to explore donation wishes. The bedside nurse has a vital role in supporting a family through these conversations. It is unlikely that any family will be willing to consider organ donation if they haven't yet come to terms with the death or imminent death of their loved one. Try to confirm a family's acceptance of the bad news imparted before the specialist nurse moves on to explore donation wishes. Families that have taken in the bad news often move from questions about treatment, prognosis, and coming home to asking about pain control, religious last rites, and funeral arrangements. Before you finish, perhaps it would be useful to try and tie all this together by simulating a DCD donation. Many steps need to come together for a donation to be successful. Donation is a real team effort. Mr. Jones, a 65-year-old gentleman, was admitted to ICU a week ago with severe pneumonia. Sadly, his condition has gradually deteriorated despite critical care support. His family and the intensive care team have come to a collaborative decision that intensive care is no longer giving him the chance of a reasonable recovery, but merely prolonging the dying process, and therefore that continuing invasive support is no longer in his best interests. They propose to stop the invasive treatment and adopt a palliative approach once his family have had chance to say their goodbyes. Earlier in the day, the ICU team recognised that Mr. Jones could be a donor and referred him to the specialist nurse for organ donation. The specialist nurse finds that Mr. Jones is on the organ donor register. The bedside nurse, ICU doctor, and specialist nurse for organ donation plan together how to best approach his family and confirm his end-of-life wishes. His family confirm he wished to help others after his death by donating organs for transplantation. The specialist nurse completes the consent process with his family, and meanwhile an organ retrieval team is mobilised. Several hours later, once the retrieval team are in place and all preparations for donation are complete, treatment is withdrawn by the ICU team as planned earlier in the day. The critical care team provide best practice palliative care for Mr. Jones whilst his family sit with him. An ICU doctor stays close to Mr. Jones, and when he slips away a short time later, diagnoses death after 5 minutes of asystole. After the confirmation of death, Mr. Jones is transferred to the operating theatre for organ retrieval. Retrieval must commence within a few minutes of death in order for his organs to be suitable for donation. Donated organs are carefully transported to their different transplant centres. One donor can save up to 9 lives. Thanks very much for your attention. If you've not come across donation before, we hope this film has provided you with a good introduction. Or, if you've buckets of donation experience, then we hope it's been a useful refresher. Here are some key messages to finish. One in 3 people have registered a wish to donate their organs after death. Only by checking the organ donor register will you know if your patient is one of them. Refer patients undergoing brainstem tests or in whom withdrawal of life-sustaining treatment is planned to a specialist nurse for organ donation. A specialist nurse for organ donation will check the organ donor register and confirm if your patient could be a donor. Up to 9 individuals can receive the life-saving transplant they've been waiting for from a single donor. You are a vital part of that story. Caring for patients at the end of their life is one of the most important and rewarding parts of critical care. Organ donation is not right for everyone, but all of us deserve to have our end-of-life wishes honoured. To some amazing individuals and their families, this includes giving an organ so that someone else can have a life-saving transplant.